911 confirmed aggregate cases of coronavirus since the very beginning of the pandemic. That is an increase of 42 new cases overnight. There have been, as you know, 729 deaths due to the coronavirus in Victoria. No new deaths since the report I gave you yesterday. There are 118 Victorians in hospital. 11 of those are in intensive care and 7 of those 11 are on a ventilator. A total of 2,506,513 test results have been received, which is an increase of 8,803 since yesterday. So they will be Sunday's results and are broadly on trend in terms of weekend numbers. Thank you to each and every one of those people for getting tested. And again, the reminder, the very clear appeal and request to every single Victorian, regardless of your circumstance, your postcode, if you've got symptoms, even mild ones, please come forward and get tested. It is a massive contribution that you can make to our collective efforts to defeat this second wave. There are 4,282 cases with an unknown source. That's a decrease of 9 since yesterday. There are 158 healthcare workers who are active cases. We send them our best wishes and we thank them and all their colleagues for their amazing work. There are 1,040 active cases across the state, so that number continues to fall. That trend is very much with us. In terms of regional Victorian cases, there are no new cases in regional Victoria, and that means there are just 43 active cases across regional local government areas that are currently under stage 3. I will come back to regional Victoria in just a moment. In terms of the rolling averages 1 September to 14 September, 52.9 in Metro, 3.6 in regional Victoria. And there are no new mystery cases in regional Victoria. There is one mystery case from the 1st of September. So at the end of today, that person will come out of those numbers because it has been 14 days since their positive test. Active cases in disability facility settings, there are 10, 6 staff, 4 residents. Aged care shifts that have been worked by hospital staff, 4,426 shifts, quite an amazing effort, a massive effort to look after the most vulnerable, and we thank each and every one of those hospital staff who've gone into aged care and done such a tremendous job. There are 515 active cases in aged care as we update you today. Now, because there are less than 5 cases for a 14-day period and there are no mystery cases in regional Victoria, I am absolutely delighted to be able to announce that regional Victoria from 11:59 p.m. tomorrow night will be able to take the third step in our safe and steady roadmap to COVID normal. That is a massive, it's a massive thing. It is such good news. I am so pleased and proud of every single regional Victorian who has stayed the course, followed the rules, got tested. They've done an amazing job. And I know it hasn't been easy because there have been many communities where, to the best of our knowledge, there has not been virus. But you've always got to be conservative, you've always got to be cautious. What this means, off public health advice, we're able to make further announcements today, and regional Victoria will be opening up in just the next 24 hours or so. It is a massive thing. It is a very positive thing. It is something we should all be very pleased and proud of the job that regional Victorians have done. This will be welcomed, I'm sure, and there's no greater evidence to the people of Melbourne that these strategies, getting numbers low, is possible and it is essential. You have no chance of keeping numbers low once you open up if you don't first get them low via the restrictions and the rules we have in place. This is a credit to everyone in regional Victoria. I am proud of you, I am grateful to you, and I'm so pleased to be able to make these announcements today. To give you a sense of what these changes to the rules will mean, the 4 reasons to leave your home will no longer apply, gathering limits will increase, and most workplaces will reopen. Restrictions on businesses and visitors do remain in place regarding people caps, physical distancing, the wearing of masks, things of that nature. But the key changes include outdoor gathering limits will increase to 10 people. Infants under 12 months are not included in the calculation of that 10. The household bubble is introduced where up to 5 visitors are allowed in the home from a nominated household. School will be a staggered start over the first couple of weeks of term 4. and we will have more to say about the exact age groups, year levels, that'll be coming back over those first 2 weeks of Term 4. But that will be essentially all classes, all schools across regional Victoria will have as close to a normal Term 4 as we can possibly deliver. Hospitality and entertainment will be allowed, subject to gathering limits and some other requirements around density. Retail, of course, has remained open and will be expanded to include personal services such as beauty and tattooing where a mask can be worn. For real estate services, outdoor auctions will be permitted with a limit of 10 people. All community sport will return for children. Non-contact sport will be permitted for adults. Gathering limits for weddings will increase to 10 people and for funerals to 20 mourners. Outdoor religious gatherings will increase to up to 10 people plus one faith leader. Tourist accommodation will open for regional Victorians in regional Victoria for them to travel and holiday within regional Victoria. Every business, every single business across regional Victoria will be required to have a COVID-safe plan, and those plans will be enforced from the 28th of September. If I can just talk about hospitality just for a moment before we go to questions, you would appreciate with the Upper House of Parliament sitting, Jenny has a time commitment, so we'll go straight to questions once I'm finished running through this. This will be predominantly outdoor, that is for cafes, bars, restaurants, pubs, subject to gathering limits and density quotients. Only table service will be allowed, and there will be a 2-hour limit on bookings. For indoor service venues, they can open with a cap of 10 seated patrons per space, subject to a 1 to 4 square metre density rule. There will also be a maximum of 2 such spaces. So 2 spaces inside, a maximum of 10 each. So for larger venues, that would be 20 people inside. This is from, again, midnight tomorrow night. For outdoor service, more customers can be seated. There are different arrangements there, but essentially outdoor service venues, there will be a cap of 50 seated patrons per space, subject to density requirements at 1 per 2 square metres. Group limits of 10 apply as well. The key point there is that tables will need to be 1.5 metres apart. So for many venues, larger venues, they will be able to have up to 70 people seated at any one time. So others may have different outdoor areas which are quite separate. Again, there will be advice, assistance, guidelines, very detailed conversations over the next 24 hours with various peak bodies, and of course we're there to provide advice to any and all individual businesses who need that. I know that many would like more. They'd like more inside particularly, but the risk of infection is dramatically higher inside. This is, I think, a reasonable compromise. There are, as I said, up to 20 people inside, 50 people outside. That is a significant step. Those venues are currently closed at the moment and are doing takeaway only. So that is a very significant step. Now, as these weeks pass, as we see this model actually working, and we've got real data, and we've got a really clear picture of what this means for the amount of virus in regional Victoria, then of course we don't rule out monitoring that and being informed by that, not just for the purposes of settings in regional Victoria, but to all of those in the hospitality sector in metropolitan Melbourne. All of this work in regional Victoria will help to inform the early steps and subsequent steps that we will take in metropolitan Melbourne as well. In some respects, many, I think, had expected there would be no patrons inside. We've gone through this in fine detail, and the public health advice confirms that we can have 2 groups of up to 10 each. That is significant. I'm not for a moment pretending that many wouldn't like that number to be much higher, but this is a big step, a very, very big step today, but it is a safe step and one that can strike that balance between more economic activity, more money in the till, more people back at work, but not risking having to close down again, not risking frittering away all the hard work that regional Victorians have done. Just in terms of movement from Melbourne to regional Victoria, those reasons have not changed. You cannot be travelling to regional Victoria unless you absolutely need to. Those reasons are particularly well understood. We will have more to say about some changes some enhancements that Victoria Police will make in terms of the border between metropolitan Melbourne and regional Victoria. That will relate to the percentage of cars that will be pulled over. That will also relate to penalties. We can't have people travelling unnecessarily and unlawfully into regional Victoria from metropolitan Melbourne and potentially taking the virus with them. We know and understand that regional Victorians have done a mighty job, an amazing job to get these numbers down. That allows us to open up, as we've indicated. There'll be a table, I think, provided to each of you at the end of the press conferences to go through some of the finer detail, and if there's any clarification we need to give you, of course we will. But these are really significant steps, and they must be done safely. And if people are travelling into regional Victoria for no good reason, given the amount of virus in metropolitan Melbourne is higher, much higher in fact, then that risks the virus travelling with them. We simply can't have that happen. We'll have more to say about those detailed arrangements tomorrow, and we'll also have more to say about other things that are consequent to this in the days to come. But this is a great day for regional Victoria. I am proud of regional Victorians. I am grateful to regional Victorians. This is a day of hope and optimism. This strategy is working. It has worked in regional Victoria. It is working in metropolitan Melbourne. You can get these numbers down, and you must get these numbers down. If you're going to open up and keep numbers low, there is simply no chance to do that unless you have got them low to start with. Otherwise, we'll be open, yes, but we won't be open for very long. Well done, regional Victoria. This is an amazing effort and a really hopeful and positive day. We're happy to take any questions you have.
What's going to be the protocols for making sure Melburnians don't get into regional Victoria?
Again, there are rules in place now in terms of who can travel. Those rules are not so much the rules themselves changing, but the enforcement will be beefed up even further.
What does that look like?
But what it'll mean is that you'll finish up with even more cars being stopped. We'll come back on the exact figure, the exact percentage tomorrow, but it will, I'm sorry to say, it will mean that there will be significant queues, there will be traffic issues, but I think that regional Victorians understand, and regional Victorians, certainly the message I get, is that they very jealously guard the low numbers, the low virus status that regional Victoria enjoys today, and they want to keep it that way. So there will be a time later in the year when we can have that freedom of movement. We can't have it now because it puts at risk everything that is possible in regional Victoria because the numbers are low. We'll also have a bit more to say about the likely fine that you would be issued with if you were to be in regional Victoria from Melbourne without a lawful reason. This is very serious. Very, very serious. We cannot have people making unnecessary and unlawful trips to regional Victoria and potentially taking the virus with them. Regional Victorians have given too much and achieved too much to put that at risk. I simply won't allow that to happen. So we're going to do everything we can to make sure that people are stopped, fined and turned around and sent back to the metropolitan address where they should never have really left, Rich.
People who have second properties still can't move to their second
Correct.
properties.
Would you give any consideration to including the Mornington Peninsula in regional Victoria, given there's fewer cases there than, say, Geelong?
We're not changing the boundary. The definition of what's metro and what's regional remains in place. But we'll have more to say about the enforcement activity on approach to the Mornington Peninsula. We'll talk about that tomorrow, because obviously there are many second residences down there, and it's not appropriate as we come up to the school holidays and warmer weather, for instance, for people to be travelling to a second residence. That's simply not on. That puts everything at risk. That's unnecessary movement, it's unlawful movement, and it should not be happening. And we'll have more to say about exactly how we're going to enforce that with particular reference to the Mornington Peninsula. That won't change its status as part of Metro Melbourne, but hopefully it will give people who are permanent residents down in that beautiful part of our state, it'll give them the reassurance to know that only those who live there will be travelling there, and there won't be people going down for day trips and things of that nature.
Is there some hope now then for hospitality in Melbourne that if it works okay indoors in country Victoria, you may open up sections indoor maybe as early as late October?
Well, we're not here today to revise the timeline for metropolitan Melbourne, but I will say this. Because we've been able to achieve very low numbers in regional Victoria and keep them low, drive them down to these very, very small numbers, then we have the freedom, we have the opportunity to do some things in regional Victoria that will just not be possible in metropolitan Melbourne right now. We will closely monitor exactly what occurs. both to make sure that we don't have a problem in regional Victoria, but also to inform what is likely to be safe and steady once the time comes in metropolitan Melbourne. So I know there'll be many people in the hospitality sector who have assumed that there would be no indoors. We believe it is safe to have those two spaces with no more than 10 people in each. We think that strikes the right balance. That'll be very closely monitored. There's rules about deep cleaning, there's rules about staff being healthy when they begin the shift. There are, as I said, there's a 2-hour limit, so it's not like you can sit there all day and be there for hours and hours and hours. All of those things, I'm very confident that the hospitality sector will rise to that challenge. They take the hygiene and the safety of their venues incredibly seriously, and I think it'll be a very important demonstration project in some ways, Nick, for what might be possible in Metro Melbourne. I can't commit to that today because it needs to be monitored. We need to see how it works. But as I said, this is a very hopeful day. It's a very positive day. Regional Victorians have done a mighty job, and now we're able to make these really important announcements. What's more, this shows every Victorian, you can get these numbers low if we all stick together, if we all work together, and if we all stay the course. That's where we are today, and it's a credit to every single person in regional Vic.
Can we ask Alan about the other good news of the day? I guess the zero in the
Yes.
deaths column. It's been a couple of months since we've seen that.
It is very pleasing. The reason that I've not made a big thing of that is because I can't be certain the status of people in hospital, the status of people who are still gravely ill, Lundy. There are many people still who are fighting this virus, and it's a very tough fight. I can't guarantee that number holds tomorrow, but what we do know is that those numbers have been coming down, and that's a direct result of lots of different work, lots of different efforts. It's very pleasing, but I can't for a moment pretend that there'll be no deaths tomorrow. That's the nature of this virus. This is not a good thing to get, whether you're frail and aged or otherwise healthy and young. This has been glossed over a bit, but I just want to make this point before I throw to Alan. There is growing evidence across the world that otherwise fit and healthy young people are getting this. It's not fatal, but it's not a common cold either, where you just shake it off and you can barely remember you had it a week or two later. It is presenting in some as a chronic illness, a chronic condition that has long-lasting effects. This is not something anyone should treat lightly. It's not something anyone should think, oh, well, if I get it, I'm otherwise healthy, I'll be fine. This is novel, it is nasty, and it spreads wildly. So we all have to be focused on that as well. As tragic and as important as being upfront about those people who've died because of this, there's also other cohorts, and we're learning more about this virus every day because it is a novel virus. Alan can add to my comments.
Sorry, just further to that, no deaths, but how many of today's cases are linked to aged care and, where?
So at the moment there are 511 active cases in aged care, and that's a total of 4,432 cases in aged care. So I think just...
You said 515. Can we have some clarification?
I've got 511. I don't. Sometimes there's when they're case events, they're double counted if they're linked to more than one case, more than one location. But I've got 511 active cases in aged care. So just to reinforce, clearly it's much better to be announcing no new deaths yesterday compared to 20 or 30 deaths that we were reporting about a month ago. But just to reinforce that there are 118 people in hospital and 11 in intensive care, and 511 active cases linked to aged care. So there are likely to be deaths ongoing, but clearly, it's much lower than it was, and we'll take that. I thought with permission, I thought I'd just talk through somehow of how we made that assessment about regional Victoria, because it's not just about the numbers. So clearly we sort of asked ourselves three questions. Firstly, what are the numbers? Secondly, what is the chance that an active case will transmit as an ongoing downstream transmission? And then what's the chance that there are other unknown cases out there that we don't know about? So the case counts have been decreasing, 50 cases in the last 2 weeks. 31 of those cases were in Coal Lake, Otway, but the last of those cases that were reported were a couple of days ago. Geelong has had 8 cases in the last 2 weeks. So some of those have been linked to workplaces in Melbourne or outbreaks in Melbourne. At 11:30 last night, a case was reported in Shepparton that we've since been able to establish. Actually, the residential address was in Shepparton, and the case actually was interstate. The last unknown source case, as mentioned, was on the 1st of September, and there have been no further cases around that, so we'd be relatively confident there's no ongoing transmission there. The likelihood of onward transmission from recent cases, we know that there are 445 active contacts in the regions. We expect that some of those may turn out to be cases, but because we know that they are contacts and they're being monitored, we don't expect that they will continue to transmit on. 80% of people that were diagnosed in the regions in the last couple of weeks were in isolation at the time of symptom onset. So again, a high proportion of those not posing a risk for onward transmission. In terms of the likelihood of unknown cases still out there, there's been good testing. So in all regions and all LGAs, there's been more than 1 test per 100 population in the last 2 weeks. So that's essentially 1% of the population has been tested. In the areas where there have been cases, like Colac and Bendigo, Ballarat and Geelong, there've been substantially more than 1 test per 100 people. So we'd be relatively confident that we're not missing anyone out there. We've been doing sewage testing, as you may know, and there has been a positive in Apollo Bay. But about 10% of the population of Apollo Bay have been tested, and we've not found any cases. So we're again relatively confident that there's no unknown cases on the basis of that. I think it'd be fair to say that, you know, there will be more cases in regional Victoria. Obviously, today is a day that we can say that it's safe to start relaxing restrictions, but the price of that is that we need to continue to be vigilant, that workplaces and people need to have, to be aware that if they become unwell, they need to get tested and go home. They need to pay attention to all the hygiene measures and wear masks and so on, and observe all the restrictions to be careful. So it's trying to give you the picture that it's not just a number that we've been aiming for, but it's a whole suite of things that we've been looking at to make sure that it is safe for regional Victoria to open up.
With the new cases today, I think it's 42. Have you seen more in that southeast corridor, that Hallam?
So yesterday in Casey LGA there were only 3 cases. There had been 10 the day before and 10 the day before that. So it does seem to be decreasing. We are obviously very concerned about that cluster and keeping a very close eye on that. And there's been pop-up clinics.
How many today are linked to that emerging cluster?
Sorry?
How many of today's numbers are linked to that emerging cluster that Brett talked about yesterday? I think it was 9 cases.
So I haven't got that number, but I know that there are only 3 in the Casey LGA, which encompasses that area.
Brett was talking yesterday about taking special efforts to work with the local communities there. Is that happening now?
Yes, absolutely. So I think Brett gave some talks to community leaders out there. There's ongoing work, as there has been throughout all of this. There are pop-up clinics that have been stood up in the Casey and that region to just make sure that it's easy for people to get tested if they're unwell.
Jenny, can I just ask, with regional Victoria moving to the next step, is there scope to restart elective surgery in those regional hospitals like Bendigo, Ballarat, Gippsland?
Sure. So firstly, can I firstly congratulate regional Victorians for the amazing job that they have done, and today is also another significant day for regional Victorians, as the Mildura Base Public Hospital has returned to the people of Mildura and the people of the Mallee. A year ago, the Premier and I travelled to Mildura to make that commitment that we would return that hospital back to public hands. It was a hospital that was run privately for the last 20 years, privatised by the Kennett government, and I'm very proud of the people of Mildura and the Mallee who advocated for this return. Our government listened, and today is a really important day for the people of Mildura and Mallee, and I know they'll be really, really excited. It is the biggest employer in town, 900 staff working there. I just wanted to take this opportunity to thank them for the amazing work that they have all done over the past year, not just working on the transition but also responding to the pandemic as well. So a very proud day for Mildura and the Mallee community. Just in terms of elective surgery, the government has been working on a plan to resume elective surgery safely. We'll have more to say about that very, very soon. We are looking, of course, at a staged process. You might recall that the reason why we paused elective surgery to begin with was because of the private aged care crisis facing our state. I'm grateful to the nurses in particular, but all the hospital staff who have stepped in to our private aged care facilities right across the state, but particularly here in Melbourne, and who have provided many shifts to support them. So we are looking at a staged process of resuming elective surgery safely. There may well be two speeds, a faster process for regional Victoria in line with today's announcement, but we'll have more to say about that very, very soon.
Just another question for Alan, if I may,
Sure.
if that's okay. Brett said previously that once we got the numbers down, we'd get a greater breakdown of, like we had in the first wave, of what those numbers were, what clusters they were linked to, and that kind of thing. Now that we are in the 30s and 40s, are you intending to do that? I know New South Wales will give the date it was notified, the source of acquisition, the LGA. Will we move to that?
So I think we already have a fair bit of information on the website by postcode, by LGA. Happy to work with you
But
to work
in
out.
terms of just each day's cases, you know, this is however many are linked to this cluster. We don't know which cluster these ones are linked to. Those sorts of numbers that we used to get.
Yeah, I'll have a chat to Brett and see what we can get you. Yep.
In relation to the regional Victoria opening up, should people in metropolitan Melbourne be a bit cautious in looking to that model and how it's working and thinking that's what it will look like for us, given that you say a big consideration are sort of the unknown cases that may still be out there. Obviously, metropolitan Melbourne's got so many more cases that we know about, so therefore probably so many more that we don't know about. And also just the fact that, you know, there are so many cases here. Can the two models be compared?
Look, I think, I think in a sense, you know, regional Victoria are doing now will be a dry run for what will happen in Melbourne. I expect that, you know, we'll be making the same sort of assessment, hopefully in a number of weeks' time, to say that, you know, it's safe for Melbourne to open up. I think hopefully we will also learn things. We've certainly learned things from, you know, the first between the first phase and the second phase of this this epidemic. That, you know, we now know that, you know, for example, we're encouraging a lot more activity to happen outside because that's much safer. So I think hopefully we will learn things from regional Victoria that we'll be able to apply. So, you know, we're doing a lot of this for the first or second time, and you know, we need that evidence to plan what we will, what the next step will look like in Melbourne as well. But a lot of the, you know, the general settings have been sort of put in place, I think, in Melbourne, and they may be tweaked as more evidence comes in.
Alan, has there been any, in Victoria, has there been any case of corona actually tracked back to a hospitality venue?
Look, I couldn't say that off the top of my head. There certainly have been outbreaks at hospitality venues elsewhere in the world. I can't tell you off the top of my head if there have been here. But also making the case that just because we don't know of them doesn't mean they don't occur. You know, there's a lot of places where there's, you know, cases have been, and we don't know where they've come from. And we don't know where they've come from. They could have come from any setting. We certainly know that indoor settings are much higher risk than outdoor settings, and so I wouldn't expect a hospitality venue to be any different to you know, other settings for a variety of reasons.
Premier, Regional Victoria's taken 2 steps this week. Can Melbourne take 2 steps a week before October 26th, I think it is?
Rich, there was a similar question, slightly different construction, but a similar question asked the other day. Case numbers are one part of this. the narrative or the story that sits behind each of those case numbers. So where did they get it? How much do we know? How confident are we that it's actually contained? And then the other thing here as well is the passage of time, as painful as it is also an important part of this. And I'll make the point again, decisions you make today, so these decisions that we've announced today, this amazing 2 steps in just a couple of days for regional Victoria, we won't see the full impact of that from a virus transmission point of view for 10 to 14 days. So sometimes it isn't just about case numbers and the story behind each of those cases. It's also about allowing enough time to pass so that you can be clear, because of the latency of this virus, the nature of it, what the impact of any decisions you've made are. The key point here, we will take steps as quickly as we can from a safety point of view and from that sense of certainty that what we're doing doesn't throw away everything that metropolitan Melburnians have done for months now. We know it's tough. It'll be done as quick as it can safely be done. But again, it's back to those points I've made many, many times. If we do too much too quickly, then we'll be open, yes, and that'll be fantastic for a very short period of time. And, people are entitled to their views, but we're not going to be pressured into doing something that is fundamentally unsafe. We're just not, because I don't want to have to stand here in a few months' time and say that, well, we actually did too much too soon, we went against the advice of experts, and now we have to put restrictions back on, whatever those restrictions might be.
It's quite, some people are already expressing it, they're happy for regional Victoria, but it's a bit of a bittersweet moment for Melburnians because it seems like they're now the only people who are still locked up in Australia.
Well, no, I wouldn't see it that way.
That's what some
No,
people
that's fair enough. I would respectfully say I'd encourage people not to see it that way, and instead to see this as proof positive, not a model, not an academic exercise, not a theory. This is not a theoretical thing. We have actually driven case numbers down to very low numbers in regional Victoria. That's taken some time. We stayed the course, and now we can open up, and that should be something that I think inspires confidence and a real sense of hope that the same thing can be achieved to the best of our ability across metropolitan Melbourne.
Is camping allowed in regional Victoria now?
I'm not sure where we've settled on exactly where and when. I'll come back to you with some rules. There'll be lots of detail that needs to come forward over these next 12 hours or so.
And gyms? Sorry, Nick.
No, gyms will have to be outside. It's such a high risk environment that, and we've discussed this a few times now, I think Brett and Alan and others have spoken directly to the really significant risk that those indoor environments, particularly ones where, really rigorous physical activities going on, that is just not safe.
There's a bit of concern in the border areas, particularly along the Murray, about trying to coordinate the restrictions on both sides, so both sides
Yes.
are working together. Have you been able to talk to the Premier of New South Wales to help the Victorian accommodation?
So what I've done is I've had communications with Gladys and with Stephen to make sure that they're fully briefed and fully aware on the steps that we've taken and the precautions we're putting in place as part of the regional Victoria opening up. In the first instance, that's to make sure that some of the concessions, some of the enhanced arrangements we've had in recent weeks are not put at risk. Beyond that, we will continue to talk with them about, trying to be as consistent as possible, trying to facilitate as much movement as is safe. But the first order issue, Nick, was to make sure that in opening up regional Victoria, we didn't get a situation where New South Wales suddenly said, well, those ag workers that we've got moving, some of the permits we've got, all of a sudden we're not comfortable with that. So we're very, very deeply engaged with them.
And have you got the clearance from New South Wales on that?
I'll leave them to make announcements, but I think it's fair to say, in my discussions with Gladys, they're comfortable with the arrangements that we've put in place. But again, I'll leave it for them to make any announcements, whether they need to or not. With South Australia, again, I'd be confident as well. But my offer really to Stephen last night was, look, we'll give you all the information you need and more so that you can have a really clear picture of what's going on in those border towns. And you can have a really clear picture of what the virus is doing in very soon to be opened up regional Vic, so that doesn't impact and doesn't see them have to revisit any of the concessions, for want of a better term, that they've made around movement and that bubble, if you like, that they've got. that was important. The next job of work, obviously, is to get those borders open, and the best thing to achieve that outcome is that we stay the course, get the numbers down across the state to very low levels, and then we'll be able to have that freedom of movement within Victoria and obviously into other states.
Premier, why the cap of just 20 indoors for some of those? Some of those country pubs are very big places, multiple rooms, could have 10, 10 and 10. Why cap 20?
Because it's not just about where people are sitting, it's also about using bathroom facilities, things of that nature. And it is a tough judgment to make, and I fully acknowledge there'll be plenty of publicans and plenty of restaurateurs who would love to have more inside than that. That is as much as we can give them at this point. It's more than what was foreshadowed, but we think it is safe. So 10 per space, maximum of 2 spaces. Again, I'm not announcing this today, but if we get 3 weeks down the track and we think this is working well, then we obviously reserve the right to maybe add to this, to tweak it in different ways, to maybe grow the number of groups or the number of people outside. All those things are on the table, and that's that key point about modelling versus data. The actuals, what happens each and every day, not in a theoretical sense, but in a very real sense, that has informed the decisions we announced today, and it'll inform any other decisions that we can make. Just on that point, I know there'll be some concern for people of faith across Victoria. This has been a really challenging year, not being able to come together to worship together. That's a really important part of those people's lives. We've got an expansion here, 10 outdoors plus the priest, the rabbi, the minister. We'll look at that over the next 2 or 3 weeks, and based on the broader picture in regional Victoria, it is possible that we could have larger outdoor services, but we just need a little bit more time just to see what the impact of all this easing is. I know that'll be of concern to many people. It's certainly an issue that's been raised.
Just on the next steps, does regional Victoria have to wait for Melbourne to take any more steps to take its last step to a COVID normal?
Well, I think the answer I just gave in terms of we'll be guided by the actual performance on the ground, if you like, the actual number of cases and what impact this opening up has. So we always reserve the right to make sure common sense drives us, the data drives us, and the actual experience. So as you have days and weeks pass when you're open, or much closer to normal, certainly more open than you were last week, you input those and they take the place of some of the assumptions that you made months and months ago, weeks and weeks ago. So it's a constantly evolving thing. But I do, again, to stress the point, numbers are important, yes. What sits behind those numbers in terms of the narrative of how the person got it, is it properly contained? And then that passage of time issue, because there's that lag and you don't start to see the impacts of whatever you've done. You don't see the virus isn't visible to you for 10 to 14 days. Some passage of time is a very important part of this. I know that's deeply frustrating, and everyone would like to be able to go from one step to the next in a space of days, but you can't do that because you literally have no sense of what each of those decisions has meant for the amount of virus that's out there.
The opposition says the waiting list, elective surgery waiting list, has ballooned out to about 100,000. Is that an accurate figure? And why not a sense of urgency about getting elective?
Well, no, there is. There is an absolute sense of urgency, but it has to be done safely. And we'll have announcements to make very soon about the resumption of elective surgery. And we know that this has had a very significant impact on people in categories 3 and those in the back end of category 2. But if you're going to create space to take private aged care patients into our hospitals, if you're going to provide them with the care and support that they need, then you have to create that space. And it wasn't beyond that also, the notion of, there's been a fair bit of hospital-based infection because of the wildly infectious nature of this virus. So it's been appropriate to try and limit the number of people, many of whom themselves have underlying health issues well beyond their surgery. Limiting their movement in and out of health settings was appropriate at the time, but we're getting very close to being able to have more to say about the resumption of elective surgery. But it won't be 0 to 100. We won't be going straight back to, to the full tilt. It'll need to be staggered. And then we'll have more to say about a blitz as well, Nick, to make sure that we do the catch-up that's very important also.
And that figure of 100,000, is that accurate?
I don't have the latest number. I'm not sure, but I'll try and get you the number. In fact, I think that might have been provided to one of your colleagues who asked a question yesterday. There you go, I'll chase it up for you, for all of you.
Premier, thousands of Australians remain stranded overseas. When can we see Victoria start to take arrivals back in?
It's too early for us to say, but we will resume flights coming to Melbourne, and we will have arrangements in place that are as safe as they possibly can be to facilitate that. But at this stage, our focus needs to be elsewhere, and I apologise for any challenges, any difficulties that poses for people who have to return via other states, but there's no alternative. We need to be focused on really one thing and one thing only, and that's getting these numbers as low as we possibly can. And there will be a time for those flights to resume.
Do you expect that to occur before Christmas?
Look, to be honest, I don't. No decision has been made. I think that's likely. But the other point to make here as well is, we've got a process going on at the moment to give us findings, to give us advice, and we would want the benefit of that before we put any final model in place as well.
Given that Melbourne took the lion's share of people prior to this second wave, should the other states be lifting their caps to allow more Victorians to return?
Well, just for the purposes of accuracy, we took more than 20,000 people. I think that number would be exceeded by Sydney, so I wouldn't want to rob Sydney of their claim to have processed more than we did. I think they did at the time, and of course that number's grown very, very steadily since we stopped flights coming back here. Look, there are different states are in different places. The flight patterns, where planes land, that's always been probably the biggest determinant of how many return travellers came into each city. And cities are different beyond that as well too. For instance, there's been many more cruise ships going to New South Wales, going to Sydney, because that's a much bigger feature of their market, if you like. So I'm not here today to comment on what other states are doing. All I can say is, from our point of view, we've made many requests of other states, and they've always delivered, and we're very, very grateful to them.
A lot of people expressing their displeasure with you and what you've been doing over the past few months is a Give Dan the Boot campaign, including photos of boots out in front of, I think it's your old farm where your father's funeral was. Is that stepping over the line, do you think?
Oh, look, Lundy, I'd say that we're at our best and our strongest as a state when we come together, when we look out for each other. I think it's equally true to say that we're at our worst and our weakest when this nastiness, this divisiveness comes into the challenges that we face. I saw that photo. That photo was sent to me by someone. That's not the front gate to that farm. I know that farm well. That had been positioned. Those boots had been positioned not at the front gate, but at a different gate to make a point. I'm happy for people to make their points, provided they're not doing anything to spread the coronavirus. But I'll just say this. Having different views, to me, that's fine. It's a healthy part of our democratic society. But decency matters too. The last time I was in that shed was when I carried my father's coffin out of it. And I think that is... I won't use the words that my father would use to describe that sort of act. That's just low, and has no place. No place. Have a different view to me, but leave my family out of it, and particularly the dead members of my family out of it. I don't think that's too much to ask. Shame on him. Shame.
On another matter, have you got any update on the police shooting today?
I know I don't, but police, I understand, will be out at about 1, Rich, and they can take you through. There's a number of matters they need to deal with. There's that incident, and then there is the other matter where an officer has been stood down. Obviously, I can't comment on that. They can. They can give you some further details, but that matter's being investigated, and as it should, because there's obviously significant public interest in that.
Have you seen that vision?
I have seen that vision, yes.
How did it make you feel?
Well, it needs to be investigated. I think that officer being stood down is the appropriate step to take, and I'll leave Victoria Police to comment in any further detail. They're the ones that will be doing that work, and they'll obviously be in a better place to work out exactly what can be said and what shouldn't be said, in order to make sure that we have a process that's fair and that family members get answers. I'll send my best wishes to that family, They're obviously doing it very tough at the moment. To have their loved one in hospital gravely ill is a very, very significant thing.
Just on policing more broadly, we've had the 2 incidents you just mentioned. We had a number of other incidents, including earlier this month, an Indigenous man who I think was riding his bike to work on the Metro tunnel. He ended up with his arm in a sling, his bike broken. Allegedly, he was called a black C word by police. Do Victoria Police have a serious cultural problem?
No, I don't believe so. And I don't think the police would concur with the way you've described that particular event. They would have a different version of events. But that's not for me to advance. That will be for them to advance. And I'm not sure whether there's a court process or any other process in relation to that person.
Are you alleging that that person is voicing untruths about what
I'm
happened?
not alleging anything. It's not for me to allege anything. I'm simply saying that police will be the ones to tell you whether that's accurate or not. And I think they might have a different view. You're free to test that with them, and that's the most appropriate thing. Whenever I don't speak about a specific case, it'll be for a good reason, and I have, where I've been safe to do so, I have spoken at length, and I communicated directly with the constable down in Frankston, who was, it will be alleged, savagely assaulted. I thought that was the appropriate thing to do. In broad terms, and in very specific terms, just so there's no doubt, Victoria Police are out there doing very important work. They do it with professionalism, they do it with skill, they do it with a genuine concern to keep the community safe. I'm grateful to them, but where an individual incident occurs, which I don't think speaks to culture, where an individual incident occurs, it should be properly investigated, and I have confidence that that's exactly what will happen.
There have been numerous individual incidents, though.
Well, if you think about the number of, I haven't got the numbers to hand, but pre-pandemic, and I don't believe this has changed, pre-pandemic, the percentage of incidents, the number of incidents as a percentage of the total daily interactions that members of Victoria Police have with Victorians, it is a low number. Every one of those incidents is taken seriously, and that's why I'd make perhaps a different judgment about police culture than the one that you put to me. People are free to have a different view, but I'm here to make it very clear on behalf of the government that we think, notwithstanding any individual incident that needs to be and will be properly and fairly and frankly investigated, my view is that Victoria Police are out there working very hard for all of us to keep all of us safe. And whether it's COVID issues or the youth gang push that was announced yesterday, I think Victoria Police have a very broad brief, and they are working very hard to make sure that pandemic and afterwards, they're out there fighting crime and keeping the community safe.
Qantas is talking about consolidating headquarters in its
Yes,
facilities.
they are.
Are you meeting, or are members of the government meeting with Qantas to ensure that Melbourne doesn't lose what it has?
I wouldn't see it in those terms. I think that there are very substantial prospects for Melbourne. I had a very productive discussion with Alan Joyce last night, and we'll be having detailed discussions, my team and his, and he and I will no doubt speak again. The process that they have announced today, I think they've made their announcement already, is one that we welcome. We think that we have a very attractive offer to make, and we'll work through that to try and have as many jobs as we possibly can in our city and state. And it was a very, very productive discussion last night.
What sort of facilities would you like to have here?
Well, I can only speak to what Qantas are looking to do. And as I understand it, they've got some heavy maintenance jobs, they've got some head office jobs. All of those jobs are essentially up for grabs, and we'll be working very hard to make sure that Victoria puts a high quality bid. We have an Avalon Airport with enormous amounts of space. We have Melbourne Airport, the largest curfew-free airport in the country. We have undeniable strengths when it comes to the sort of engineering and technical capacity, and a training system to continue to push those people through and make sure that we've got the very best of skills. We've got a very attractive offer to make. That'll be made in due course, and then it'll be up to Qantas what choice they make. But it was a very, very productive discussion.
Premier, the Prime Minister has now told the Hotels Inquiry that he wrote to you 3 times offering ADF support. Why did you tell the Victorian Parliament that there was never ADF support for the hotel quarantine on offer?
The Prime Minister's representations to the inquiry I'll leave that to the inquiry to make recommendations and findings about that. I'm not interested in having a debate with the Prime Minister or anyone else, frankly, from this podium. What I would say to you is that my comments are consistent, my comments are accurate, my comments are supported by statements that have been issued by Andrew Crisp as the Emergency Management Commissioner. I really don't have much more to add beyond that.
On the inquiry, can I just ask, you'll be appearing, and I think some other ministers have prepared to appear if they're asked to. Who funds the representation of those appearances? Is that
There are
insurers, or is
there are
that-
long-standing arrangements, and these are no different to any other inquiry or Royal Commission process or any similar process. So there's no change. They are long-standing arrangements,
It's
and
taxpayer
have not
funded.
been modified or altered in relation to this.
It's taxpayer funded though, and it's in addition to the $3 million that's been set aside for the
Yes.
inquiry, isn't it?
Yep, as is the case with all matters for many decades, perhaps even longer. Any other issues?
In terms of the sole traders, did you anticipate the backlash that because so few of them have actually got the benefits of?
Well, again, we've made announcements. That won't be the end of announcements that we make. We've got a budget coming up. We've got all manner of other opportunities to provide support in very focused, very targeted ways, but also in a much broader sense. The Commonwealth Government has the principal responsibility in relation to income support. That's what they've done. And we've added to that, over and above that. We made announcements yesterday. I've got no further announcements to make today, Nick, but we always reserve the right, and we will, and we've actually foreshadowed that when we get to the budget in later in the year, we'll have much more to say about driving confidence and demand, investment, profitability, getting people back to work, finding that COVID normal and doing the economic repair work that is absolutely essential. But you've got to deal with the health issue first. Those announcements yesterday are over and above what is essentially the primary responsibility of the Commonwealth, and I thank the Commonwealth for their job seeker and job keeper policy settings.
Would you now like the Prime Minister of the federal government to make the commitment to not cut JobKeeper
Look, it's
when
not
it comes to Victoria?
it's an important question. I had a conversation with the Prime Minister on Sunday. It's not about what I'd like. He's made his position clear. What I have asked for and what I believe to be under very active consideration is a tax-free treatment for all of the hardship payments that have been made to those businesses. I think that's a fair and reasonable outcome. As for JobKeeper and JobSeeker settings, that is entirely a matter for the federal government. But I thought it was appropriate. It's pretty clear what the Prime Minister's intentions are there. I'm not seeking to necessarily have a debate about that. But what I thought was a fair thing to ask for beyond that, given that he'd made his position clear, was a tax-free status for some businesses now. When you add up all the payments that have been made by us over the journey, it is a significant, for some businesses it is a significant amount of money. And if that can have a tax-free status from a Commonwealth point of view, given that we've made arrangements around payroll tax and JobKeeper, I think that's a fair thing. And it's not for me to make announcements, but I know that that's being actively considered, and I think that's being positively considered by the Commonwealth Government. But it's up to them to find a landing with that and to make announcements.
Will you use ADF to patrol the border between Melbourne and regional Victoria?
ADF are already supporting some roadblocks. I know that.
Given you've got such a big...
I'd leave it to Victoria Police to come back with a detailed plan. There are still well more than 1,000 ADF personnel that are in Melbourne and across Victoria today. They're doing an amazing job. Some of them have been here since the bushfires. There's never been a resistance. There's never been anything other than the grateful acceptance of ADF help, as well as support from others, whether it be Commonwealth public servants and others. But I think that'd be an issue for Shane Patton to work out. If he needed more, for instance, then he'd have a conversation with Lisa, and then we'd ask the Commonwealth to do that. Or we'd engage directly with Commodore Hill and say, can we move some people from one area across to doing another task? That's happened, and I certainly couldn't rule it out happening again. Any other issues? This is a great day for regional Victoria and a great day for our state. As challenging as the settings are in metropolitan Melbourne, this shows you can get the numbers down, you can keep them low, and then you can open up. I want to congratulate and thank every single person in regional Victoria for the amazing job they've done. And we'll continue to work with industry, we'll continue to add to the announcements I've made today, and then we'll monitor how that goes in the days and the weeks and the months ahead. and then that'll inform what happens in Melbourne, and we'll refine it and enhance it. But this is a really, really significant day, and one of hope and optimism and a real positivity. And I want to thank everyone for the contribution they've made to getting us here. Thanks very much. See you tomorrow.